Dina is the perfect example of a woman who, you know, in her late 20s, early 30s, has started to really embrace all of the wonderful things that the aesthetic medical world has to offer. We've done several things together over the past year, including some laser resurfacing to really smooth out her skin and give her really beautiful texture. We've been doing Botox for a while. We've done some fillers in her cheeks and lifting her face up. We did a bit of a non-surgical lift, liquid facelift about half a year ago with some radius because Dina, as most Caucasian women who are on the smaller side, working out, going to the gym, you lose that facial volume and it just really adds years to your face. Dina's right at the perfect point where she needs a little bit of touch up. Her Botox, as she's talking and being expressive, there's some lines that are starting to come out in her forehead, and it's not that we don't want her to have any movement, but we don't want her to have sort of obvious areas where there's no Botox and other areas where there is Botox. So, and actually today we're going to be doing the treatment not with Botox but with Dysport, which is a newer product. It's a great product. It's the first FDA approved alternative to Botox. It's made by Medisys, the company that makes Perlane and Restylane. Works in the exact same manner. It's a relaxant. The carrier ingredients are slightly different. And one of the things that I like about Dysport is that it has a lactose ingredient in the carrier part of the medicine, which helps to sort of disperse it a little bit further among the muscle groups that you're targeting, which means that in a perfect example of Dina, where we don't want a lot of heavy product because we don't want her frozen and expressionless, but what we can do is really kind of dot the area and have sort of a larger area of efficacy so that one injection gets a little bit further than sometimes Botox will. Botox is great if you're doing sort of really pinpointed areas in which you don't want to spread. But since we want to use maybe a little bit lighter product and get a little bit more width out of it, Dysport is a really, really nice alternative. Plus, normally you'll save a couple dollars on it, and that's always nice, especially in this economy. So, as you can see, when Dina just has normal expressiveness, we get these lines kind of popping up. And what tends to happen is that if you let that go and you don't address it with a relaxant, they will start to actually engrave into the skin, and you'll get what's called lines at rest. And those are not something that you want because it just kind of screams out aging, premature aging in the face. So we want to get rid of that. We want to get rid of it lightly so that she still has some expression. We don't want to do any freezing. But normally the areas that we Botox, there's 3 different areas. Pull your eyebrows together, Dina. So this is considered the glabella, and she's not that deep because she was recently Botoxed about a month or 2 ago. But generally you do some Botox here along the eyebrows and some there to get rid of what we call the number 11s. That's sort of one area. If you lift your eyebrows up, this is the forehead. When you Botox, you relax this frontal muscle here called the frontalis. That's a vertical muscle, and you want to be very careful not to over Botox this area because it tends to push the eyebrows down and give you sort of a heavy forehead look. So you want to do this area very lightly and then smile. And also, this looks pretty good on her. It's nice and soft. But the third area that is most commonly Botoxed in the upper face is around the eye, or what we lovingly call the crow's feet. And also doing this area on a younger face is really desirable because it helps to sort of lift the eyebrow and give the eye a nice, open, refreshed look to it. As you'll see, the needle for Botox is very, very small. I use a small tuberculin size needle. It's teeny tiny. Some patients want to use numbing cream, which is fine. Some patients will just kind of go for it. It's just a lot of little sticks, not terribly painful. The nice thing about Botox is there's normally, most of the time, no bruising, no obvious signs, maybe a little bit of swelling to the injection points for about an hour. maybe 10 to 15% of the time afterwards you'll get a bruise if you're doing it around your eyes. But for the most part, patients can go out very easily after Botox. The only thing that's a little bit of a downer with the relaxants with either Botox or Dysport is that it does take a few days to kick in because it does need to work in to the muscle reactions. So it needs to sort of work into that system. So it takes anywhere between 3 to 5 days generally, and sometimes it will be a full sort of 2 weeks before you see the full onset and effect after your Botox treatment. So you do have to have a little bit of patience, and you also need to think about that when you're timing Botox before a special event. Generally, when I'm Botoxing someone for the first time, generally it's anywhere between 30 and 40 units is sort of my standard rate for getting all three areas, the glabella area, the number 11s, the forehead, around the eyes. And I always recommend for patients to do all three areas, not to pick and choose to do one isolated area, because then you tend to lose movement and elongate in one area and then retain movement and stay a little bit shortened in other areas. And in my eyes, it's not the best look. But again, today we're just gonna sort of lightly do all three areas, and unfortunately you won't see the final result today. But as I'm Botoxing Dina, I'm gonna ask her to make those facial expressions so I can really see where those muscles are that have the most amount of movement. Relax your face. Doesn't hurt at all, right, dear?
Not bad. It's very tolerable.
Pull together one more time. Good, and relax. Good. Great, so that's just gonna give her a little touch up. And I'm gonna just put very little, almost a half dose along her forehead, because I just really want to soften out those lines. This way. From here, turn this way a little bit. Good, lift your eyebrows again. Okay, good, relax. I don't want her to get too heavy, so I'm just putting, I almost did sort of a half dose all along her forehead there. You can sort of see those little bumps where the product went in, and those will go away within an hour or so. And then I'm just gonna do a teeny touch up just to her eyes, just to make sure that her eyebrows stay nice and high. Just squeeze your eyes shut tight for me. Good, okay, and that way I can see exactly where that muscle is, and relax. And again, I'm just putting a little tiny half dose on each side, just to make sure she stays nice and lifted. So, and now we're gonna do one more touch up. We're done with the Botox, and again, these should be gone within an hour or so. There's generally not too much bruising or discoloration after Botox, but it does take a few days for it to kick in. The other thing we're gonna do is just touch up her lips a little bit. Generally I use either Restylane or Perlane. Today we're gonna use a little bit of Perlane. It's a little bit of a thicker product than Restylane, and it tends to hold a little bit longer. And so I have it here mixed up with some lidocaine, and that's what we're gonna use to touch up her lips. One of the common problems out there when injectors do lips is allowing the filler to get above the border of the lips. And when you do that, that's what starts to look really fake. When you get too much volume leaking on top or below the border of the lips, that's what lends to a really sort of fake look. Also, not knowing when to stop and where to concentrate the volume. I tend to concentrate the volume really in the center of the lips. That's where you really kind of want to bring the focus. If you take things out too far to the edge, or you get too much of an overhang here, you start to get those cat lips, or that's when you really kind of start to get that flipped, overemphasized, overdone look. Some pretty particular about not only how I do my lips, but what products I use. I tend to really only pretty much stick with Restylane and Perlane, certainly on the first visit. They're very good products in that they really hold their shape very nicely, and I can really sort of do a very exact lip border and sculpt it exactly how I want to. And then sometimes on subsequent visits I'll use some Juvederm as a soft filler, but generally not for first visits. I'm going to start with the middle here, a little poked here. Hold on, let me center my needle. So right now I'm not too concerned with doing too much shaping. I just want to get a little bit in there so that she can start to numb up. And sometimes as you get to the side, it's a little bit more sensitive. The other thing that's difficult about doing the lips and doing them well is that lips tend to swell a lot when you're injecting them. They're very vascular. Sometimes you get some bruising. It's important that the patients understand that they're going to walk out of the office with lips that are much bigger than what the final result is going to be. They're also going to feel a lot bigger because they've been poked, they're swollen, they're numb. So really having the patient understand what they're in store for is pretty crucial. Generally, what I recommend to patients when they start doing their lips is to not get too hung up on, say, bringing in a picture of a particular celebrity that you want your lips to look like. It's not realistic. And I mean, it helps, but generally it has to be your lips, but just fuller. As you can see, even right after she's soft, she's full. There's a nice all over fullness to it. It's not too much, it's not overdone. And this is what we're looking for, even right after. They're gonna go down just a little bit. If she wants, if there's too much along the border, she can massage that down a little bit and soften that out, or she can leave it, and that will be up to her and how she feels best. But I always advise my patients, leave it alone for a couple days, let it settle, and ideally, this is really what you want when you're walking out right after. A little bit overly big because